working with a large employer here in Greater Cincinnati, thousands of employees. Chronic disease and chronic conditions were problematic and continuing to increase not only in cost but as a percentage of the population. And their participation and engagement in primary care was exceptionally low. Our studies would suggest that their costs were going to continue to increase at rates that were above market, with really no viable solution that was going to drive a meaningful outcome. They needed to see millions and millions of dollars of spend come out of their health plan. We recognized that there wasn't going to be a fast answer, but the real correct answer was to get their employees engaged at a primary care level. And we needed it 5 years ago, but we might as well start today because we're trying to curb the cost in the future. We did a full-blown market study. We talked to 10 or 12 different providers of primary care to really understand what their value proposition was. But we were encouraged by some of our peers in the industry to evaluate a company called OurHealth. And sure enough, OurHealth had built out a really unique model in the Indianapolis market called the MyClinic model, a network of independent primary care physician offices that those employers in that market could send all of their employees and spouses and kids to any one of the locations based on just convenience and access and where they lived. And that was exceptionally different than anything that we'd seen to date. The more that we dug in on OurHealth's model, the more we recognized it was extremely thorough. The financial mechanism was also exceptional. So for the employer, they're able to pay at a flat rate access for employees, spouses, and kids. And so it made it really, really predictable for the employer. And in the current world, there's nothing predictable about healthcare spend. There's also nothing predictable about out-of-pocket spend for the employee. And this particular model resolved both of those, making it convenient, making it predictable, making it easy, and we have seen engagement just go through the roof.